Good morning, everyone. Welcome to our weekly COVID-19 media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start with the numbers. So far, we have had 9,776 confirmed cases, and we have done 17,152 tests in the past 14 days. That's a new number that we're going to be reporting daily. We've done a total of 131,188 tests. We have 53 people hospitalized, including 7 who are in the intensive care unit. We have an available regional ICU capacity of 30.5% as of yesterday. That number, again, is reported now twice a week, once on Tuesdays and once on Fridays. And we would be triggered into a regional stay-at-home order if that number were to drop below 15%. We have had, we have an estimated 493 active cases and 9,161 who have been released from isolation to date. And we have had 122 Shasta County residents who have died from COVID-19. With us today, we have Robin Schurig. She's the director of the Public Health Branch of the Health and Human Services Agency. Dr. Karen Ramstrom is our health officer. Matt Pontus is the CEO for Shasta County. We've got Robert Folden from Mercy Medical Center Redding, Mark Mitchelson from Shasta Regional Medical Center, and Dean Germano from Shasta Community Health Center. Welcome, everyone. Thank you for being with us today. Robin, would you like to start us today?
Sure. Good morning. I wanted to share the latest case rate and test positivity that came out yesterday. These are from the week of January 3rd to January 9th. And our test positivity came down some, which is a good thing. It is now at 8.2%. However, our case rate has increased again, and it is at a new high over last week of 49.6 daily cases per 100,000 population. Since that's from the week after New Year's and a couple weeks after Christmas, we're hoping that that represents the peak and that we'll start to see our numbers come down again in the week following. As I've mentioned before, though, we do have a long ways to go to get back down to 7 or fewer daily cases per 100,000 population, which is what we need in order to come out of the purple tier and get back to red. And then just a reminder, Carrie already mentioned the latest ICU availability for the northern region is at 30.5%, so still not subject to the regional stay-at-home order. And the state has said that they are now only reporting on that metric twice per week on Tuesdays and Fridays. That's all I have, and I'll turn it over to Karen.
Good morning, everybody. So I was going to provide an update today on the COVID-19 vaccine status. So the total allocations in our county as of this week are 13,150 doses, and that includes 700 doses of Moderna that we received early. We received it this week instead of next. So that's good news. So those are the allocations that come to the county, and then we provide them to our approved vaccine providers in the county. So including our hospitals and our mostly our federally qualified health centers. Our current priority groups continue to be our healthcare personnel. We're really making progress with those groups, really starting to focus on our dental community this week. Our long-term care residents and individuals who are 75 and older, as well as first responders. So I wanted to just go over a little bit some of the challenges that we're having. The limited allocations are really what's been really difficult for us lately. Just having an allocation of 700 doses of Moderna in 1 week is not very much. It was not much more last week. And so that makes it hard for us to plan in advance, which makes it hard for us to keep the community informed. So we apologize about that. We're sort of planning day to day and pushing vaccine out every day and hoping that appointments that our partners have scheduled, we're just trying to keep those clinics going with vaccine supply as it comes in. You may be aware that there was a hold put on one particular lot of Moderna out of an abundance state health department, just to have an opportunity to look into, there was a large vaccine clinic and they had more than expected number of cases of anaphylaxis, and they just want to make sure that there wasn't any issues with vaccine handling or anything that we should all be aware of. We've done large clinics. Other health departments have done large clinics with this particular lot and no issues. And so we're confident that this will these doses will become back online for us. It's about 2,400 doses for us in Shasta County. So we've been scrambling the last few days to push out other and redistribute doses to get our current booked clinics covered. So those kinds of reactions are expected, and we are prepared for those, whether you're getting vaccinated in a hospital setting or a clinic setting or one of our mobile clinics. We're cautious in our mobile clinics to make sure we don't take people in those settings that have that history, but we're prepared nonetheless and have not had any issues in those settings so far, as far as those kinds of reactions we've had to treat. So where to get vaccinated? So this is the $1 million question, right? So Carrie, she's getting all of us are getting asked every day, and it's really exciting that people want to get vaccinated, and we so look forward to be able to have it just accessible on our website, and you're going to be able to go and look and see where you can make an appointment. And so we're moving in that direction. We're in a position where public health is scheduling appointments for all these different entities, and we don't normally do that. So we're doing, kind of getting by right now and hoping to have a digital platform to do that in the not too distant future, which will make it easier for us to get that information out to you all. In the interim, we have groups that we're sort of reaching out to and getting scheduled into clinics as we have vaccine doses available. And we're hoping that in the very near future, we will have additional supplies. But we're pushing out every single day the doses that we receive in public health. We're also working on additional mass vaccination options. I think most people are aware Safeway is an option, and we're working with them to also develop some mass vaccination clinics, not just the in-store vaccination options. So more to come, but happy to answer any questions. And I'm confident we're going to have some of these processes and communications down very soon. It's just limited doses is making it a little bit challenging for us. But we are getting people vaccinated. We're pushing this out, and the doses are being used by all of our partners in the community right now.
All right, thank you, Dr. Ramstrom. Matt or any of our healthcare partners, do you have anything you would like to share this morning?
Nothing this morning, thank you.
Okay.
Yeah, there's nothing really new to report. I think I mentioned previously that we're working on a more permanent structure for our COVID response on the ER deck. So, in about 3 weeks, people will see a change on our ER deck or may notice a change, and it's just to provide better control. But that's about it.
I would just add that we just had two really good days of getting the vaccine that we've been allotted out to particularly our over 75 crowd. They were very thankful, and they lined up hours before we even opened, and which concerned me a little bit because they're older folks, some of them in wheelchairs. I really look forward to the digital platform or some way to better schedule those kinds of things so we don't have to have lines that go 4 or 5 blocks long for people who otherwise are at risk in general. So, but we got the vaccine out, and people were very thankful, respectful, and it was always a heartbreak at the end of the day. We had, we were open another hour or two, but we had no vaccine left. But that was where things are at right now, right? So I'm really hoping that the supply side of this gets figured out, and so we can all, go full throttle and do what we need to do. So I'd say that.
All right. I think we are ready for media questions.
Well, Dean kind of touched on what I was going to ask. What do we do with these folks, generally older folks? If we get a storm and you have another clinic set up, where do we put them? How do we do this so they're not standing out in bad weather for hours at a time?
Well, maybe I think it goes back to what I said. We were fortunate. Well, at least one day was really a beautiful day, and the other day was pretty windy. But yes, the bad weather will be amongst us, and the walk-in piece may be efficient from the point of view of the provider because you constantly have people in front of you to give, but it's not exactly patient-friendly when you have that kind of demand. So I think it goes back to what Dr. Randstrom said, is having some kind of a digital platform to be able to register people, appoint people, know that they have a time, and that way, you can avoid the huge lines that we saw. There's other ways. I think that what public health did last Saturday with people in their cars, and that seemed to work really well. I went to go visit that. I thought that that was well organized, and kudos to public health for that. And maybe we're going to see more of those kinds of things. I think those are the kinds of things we need to think of. But I really think the key is having enough product and be some way to do a more organized appointment kind of process where there's less first come first serve kind of thing. That would be some of my thoughts on this.
Is that in the pipeline now, or say we get more vaccine doses? Do you still go with what we've done so far?
So
Go ahead, Dr. Randstrom, please.
yeah, I'm sorry, Dean. I was just going to say, yeah, we have a lot of different options in the works and that are ready to go or in process. So as I said, currently, like for example, with Safeway, they're scheduling at their pharmacies. We're working on some mass vax regular days with them that we'll do in partnership with them. And so that's going to get several hundred through, 600 to 700 through each of those, maybe 3 days a week. And so we're looking at options, whether we actually have an indoor option and an outdoor option if we want to do higher volume. So all of that's in the works as our vaccine supply increases, that we'll be able to implement those options. And, once we can schedule and we have some ideas, we have some workarounds we're doing right now for that. And I just learned some possible solution this morning. So we're exploring all of that. And, we have to realize we're just a few weeks into having vaccine. And so we're getting all of these new infrastructures established. This is not something that we normally do. And so we are so fortunate to have these clinical partners in our community that have just stepped up, and they're just being flexible and making it happen. And so that's kind of our process in the meantime. And if that particular day was anticipated to be rainy, we wouldn't have had that, pushed out to the public just to say, come one, come all. So 75 and older, we would have had a different strategy. So we're sort of looking at this day to day and making those decisions based on all of those factors at the time.
I would add that the staff themselves were so charged up by the event. I think they were feeling very mission driven at its best. This is as tiring as it can be, and we've all gone through a lot through this pandemic. But in terms of the event itself and the staff involved, they were still singing its tributes at the end of the day, how good they felt. So there's a lot of energy, a lot of enthusiasm for doing this, because they feel they're helping their community. And I think that's a really good thing when you consider how drawn down their resources are in dealing with the day-to-day that we're all dealing with, and how that can be hard sometimes. But this was a good thing from a morale standpoint for those of us who are involved in the actual events, I think.
Thank you, Dean. Dr. Randstrom, can you share what the new possible solution would be?
No, we don't have enough information. The state's definitely looking at some options, and so we're kind of learning from other health departments about what some strategies might be. So we'll keep you posted as those are lined up.
Thank you. My last question: has that the hold on the Moderna lot? Is that one of the reasons that you're not getting as many doses as you'd like?
So there's been a slowdown in the overall allocations, but there's a little bit of a hiccup this week based, with things that were scheduled, that we'd had some plans that we had to sort of just slow down just a little bit and redistribute some things. But it has caused a little bit of a hiccup. but we're getting by in the meantime. And so we're hoping to have an answer from the state in the next couple of days on that situation.
Thank you.
Good morning. I would like to get a response from Public Health regarding some feedback we've had from readers for the Record Searchlight. When we post that you are still the vaccine clinics are at this time for healthcare workers and for people ages 75 and older, and I understand you're planning on starting to vaccinate people 65 and older officially on February 1st. Just confirming that is still the case, but also I'm getting, emails from people saying, oh yes, we can, the governor said, yes, I can have a shot now. And there are people who apparently, well, at least they say they went to the clinic and got a shot. And I think I've got 2 of those emails this morning. Can we kind of address can you give kind of address that particular issue? I know that the press release yesterday said you're asking people to not come forward and get the shot if they're not in a high-risk group or one of the groups that has been cleared at this time. But could you kind of state how you would like us to address that?
Hi, Karen. Yeah, so we, as Dr. Ramstrom has mentioned, we have a very limited supply. We're asking people to please allow us to vaccinate the people who are in line right now, which are the healthcare workers who have that very close contact with people who are potentially sick. Those are the folks we need to get vaccinated first. And then our people 75 and older who are at highest risk of getting really sick if they do develop COVID. So there will be enough shots for everyone. There are not enough shots for everyone today. And so it's really important that if you are not in one of those groups, to please step back and wait your turn. We know it's really difficult, and we know there are a lot of people that want the vaccine, and we think that's great. And we will have enough. We just need people to make sure that we have the opportunity to vaccinate the people who are in those very highest risk groups first.
Thank you.
Other questions? Oh, I muted caller 1. I'm unmuting you now because there was some noise on the line, but if you are caller number 1 and you have a question, we can hear you now. Okay, well, hearing no additional questions.
Carrie, I had a page 2 on my notes that I forgot. I did want to just address the questions we've been getting about second doses. I know, people who go to a regular clinic, oftentimes they're scheduled for their second dose at the time, but when we have a big mass clinic or it might be just a walk-in clinic, you might not get scheduled for the second dose. And so we just want to let people know that kind of working on strategies for that and how we will communicate to about where those options are available. It may just be in clinic, but just making sure that you're aware of what type of vaccine clinic has. So we're working on that. But I do want to let you know that there's no maximum interval between the first and second doses. So if the second dose is administered more than 3 weeks after the first dose of Pfizer or more than a month after the first dose of Moderna, that's fine. We know that you're anxious to get your second dose, but there is protection with the first dose. And we want to maximize that by getting the second dose, but it's okay if it's a little bit delayed, and that might be the case. So bear with us. We are getting all of that in place, and we will have those doses available to cover everybody who's had a first dose to get your second dose taken care of. And we have been doing second doses already, particularly for the Pfizer, and the second doses for Moderna are just coming up now from some very early groups.
And all of that information will be at shastaready.org. If you click on vaccinations, we're updating that page frequently with more information. Right now, there's not a ton of information on there because there are not a ton of options right now beyond Safeway and a few clinics to get vaccinated. But we promise that that information will be updated as soon as we have more information about more vaccine clinics and the ways that people in those priority groups can access vaccine. Are there any other questions? Okay, thank you everyone for being here with us today. We'll see you again next Wednesday at 11 a.m. Everyone stay safe and healthy.